अगर आपने ब्लॉग को चूज किया है तो आप दूसरों की बातों में बहुत
A very good evening to one and all present here. On behalf of KAIRALI Society of Oral and Maxillofacial Pathologists, I am honored and delighted to welcome you all to today's webinar. Today we have with us Dr. NEETHA Santosh, who will be enlightening us on the pathways to dental careers in the United States for international dental graduates. Dr. NEETHA Santosh is a US board-certified oral and maxillofacial pathologist and currently clinical assistant professor at the Indiana University School of Dentistry, Indianapolis, USA. Dr. NEETHA Santosh obtained her dental degree from the Christian Dental College in India. She completed an MS in Oral and Maxillofacial Pathology at the Ohio State University College of Dentistry in 2016 under the mentorship of Dr. Carl Allen, who is the author of the canonical textbook Oral and Maxillofacial Pathology. She subsequently became a diplomate of the American Board of Oral and Maxillofacial Pathology and a fellow of the American Academy of Oral and Maxillofacial Pathology by examination in 2016. She has received multiple research and educational grants, including Delta Dental Foundation and Indiana University Center for Teaching and Learning grants. Dr. NEETHA Santosh directs multiple didactic and clinical courses for the dental and postgraduate students at IU Dental School. She also guides dental and postgraduate students in research fellowships and American Dental Education Association academic career fellowships, and her mentees have received numerous awards for their projects. She has been the recipient of several awards, including the Waldron Award from the American Academy of Oral and Maxillofacial Pathology and the 2023 Indiana University Indianapolis Women's History Month Leadership Award. Recently, she has been bestowed a distinguished fellowship in the American College of Dentists after a rigorous blind peer review process from those nominated for excellence, the highest standards of practice, and significant contributions to the dental community and society. I welcome you, ma'am. The moderator for today's session is Dr. Rakesh S., Professor and Head of the Department of Oral and Maxillofacial Pathology and Microbiology, Amrita School of Dentistry. I welcome you, sir, to chair the session. Over
Thank
to
you, Tara. Good evening, Dr. NEETHA. Really good to have you as a speaker for today's KSOMP Chiropath webinar series. The stage is all yours.
Thank you, Dr. Tara, and thank you, Dr. Rakesh, and most importantly, thank you, Dr. Mahija, and all the Executive Council of KSOMP for this wonderful opportunity. I remember when Dr. Mahija and I talked, I was kind of keenly looking forward to talking more about oral pathology because that has been my passion ever since my third year of dental school. But when Dr. Mahija said, like, probably it is a better like a topic to talk more about, like career pathway for like the young dental graduates from India. I thought this is wonderful. This is like a brilliant opportunity because apart from like my passion towards oral pathology, I'm also passionate about mentoring. And I truly believe who I am today and what I have accomplished is partly because of my mentors. I've had great mentors in my life who guided me in every step, including from my preliminary, like elementary school, till my, like even currently, like my mentors at Indiana University is helping me to advance in my career. And I thought it is a wonderful opportunity to pay it forward, especially to the young generation in India, and like, you know, to talk more about these opportunities which you have in the United States. And I clearly remember when I came to this country in 2006, I did not have anybody like at that point, especially who could guide me in a career in the United States. The more I met with people, like they guided me, like, okay, this is probably something better if you do, and this is probably a good tip, like if you want to take it. So I'm hoping I can be like a little bit help today, if at least to one person who can be like, you know, of use with this talk. That'll be a great accomplishment. So with that, let me share the screen. Complete disclaimer, this is the first time I'm presenting in meets. I had a trial run with Dr. Mahija, so I'm trying, like, I'm hoping it will go as we planned. So can you all see my screen at this point?
Yes, ma'am.
Okay, perfect. All right, so today I'm going to talk about different pathways to dental careers in the United States for international dental graduates. And outline of the presentation would be, initially I would be talking, like giving a little introduction about me, how I reached like my journey in my career, and then I would go into detail about various career advancement options in the United States. So if I trace my journey from India, like my dental career, I am from Kerala, India, and then I went to Christian Dental College in Ludhiana to do my BDS. And once I finished my BDS, I got married, and my husband was working at Indianapolis, like in the Indiana University School of Medicine. So that is how I ended up in this place, Indianapolis. And in Indianapolis, I did a research fellowship initially. Then I applied to the oral pathology residency program at Ohio State in Ohio. And then I completed that residency program. I became board certified and moved back to Indiana as a faculty at Indiana University School of Dentistry. So when I talk about my BDS, my dental college, I'm so grateful for all the opportunity I received from Christian Dental College, Ludhiana. And as many of you know, it is one of the best dental schools in India. And I was really blessed to have an education there. And I can say it kind of shaped my career too, where I decided like, oral pathology is what I'm going to do because of the various service camps which we did in different villages of Punjab as part of the community dentistry program. And that is where I was like, okay, and that was the time when I was introduced to oral pre-malignant lesions and oral cancers, where like, you know the importance of identifying an oral pre-malignant lesion at that early stage to prevent an oral malignancy from that transformation. So at the same time, we used to go to like different villages in Punjab with this community dentistry service, and I could see like people are not aware about this pre-malignant lesions or the use of tobacco and the pan use, gutka use, where you can get oral cancer later. So that is where I decided I'm going to devote my career for the betterment of that, the bigger problem, which is oral cancer. And fortunately, one important aspect about oral cancer is most of the oral malignant conditions go through that pre-malignant stage. So if we can identify at that stage, like when it is in a pre-malignant dysplastic stage, we can avoid a lot of oral cancer from happening. But what is really happening at this point is people are not realizing, or people are not going for like proper annual checkups. So by the time you diagnose an oral cancer, it is really in that like, late stage where you cannot do anything, and then there will be lymph node involvement, there will be metastasis, and that will lead to the patient's like mortality. So this is where I can say it is in this Christian Dental College, with the guidance from the faculty I had and with the service opportunity I had, I decided to devote my career to oral pathology. And so many of you probably would know, once you finish your BDS in any of the CMC, like CMC Ludhiana or CMC Vellore, you have to work 2 years in a mission hospital to kind of fulfill the service commitment to the college. So after my BDS in Ludhiana, like I worked for 2 years in a mission hospital in Kerala, and immediately after that I got married, and my husband was working at School of Medicine here in Indiana University. So that is how I ended up in Indianapolis. And when I came here in 2006, I had already decided, yes, I'm going to do like a master's in oral pathology and going to be an oral pathologist, where I can do something to reduce the incidence of oral cancer. So when I came here, it was kind of mixed feelings at that point, especially in regards to Indiana University Dental School. The excitement was because the textbook which we are using in India, the textbook, oral pathology textbook written by Dr. William Schaefer. So Dr. William Schaefer is actually a faculty of Indiana University School of Dentistry. When you come to oral pathology department at Indiana, you would see a life-size portrait of Dr. William Schaefer, and he is the person who shaped this department, and the school has a long history, like a long tradition in oral pathology because of Dr. William Schaefer. And we know that this book is being like is being read by multiple dental students in different countries. So I was so excited. Yes, I'm going to be I'm living 5 minutes away from where Dr. Schaefer was the oral pathologist. But my disappointment was Indiana University, it had an oral pathology residency program till almost 1992 or 1993. So when I came here in 2006, they kind of stopped that program due to some reasons. And so I was disappointed that, no, I cannot do a master's in Indianapolis because they do not have a oral pathology program. So that time I thought I just came to United States and I'm getting used to the whole system here. It is a completely different environment. The weather is totally different. In Kerala, we know it runs between 25 to maybe these days it's a little more hotter, 35 degrees Celsius. But here temperature goes down to minus 20 degrees Celsius. So I was literally dying. I had a little experience of winter in Punjab while doing my BDS in CMC Ludhiana, but that was nothing compared to minus 20 and minus 30. I think I used to call my mom and I used to tell her it will be a little more warmer if I sit inside the refrigerator because it was that cold outside. So I was getting used to the whole system, and research was another thing which always interested me. As in, at least in 2003-4 time in India, we did not have much opportunities regarding research in dental school. So I did not have any experience there in India regarding research, but it always intrigued me because great treatment approaches and great diagnostic approaches comes from research. So I wanted to kind of get an experience in research, and that was the time, in IU School of Dentistry, there was a research fellowship opening. So usually research fellowships are done by people who have finished their PhD because it's called postdoctoral research fellowship. And usually you should have a PhD in the United States and then you apply for this postdoctoral fellowship just to get additional experience. But because of my interest in oral pathology, I had started to volunteer with an oral pathologist at IU School of Dentistry, and then happened to see this other faculty who had this research fellowship opening, and we were just casually talking about something, and she was so do you think you're interested in doing this research fellowship with me? And I was thinking, I do not have a PhD, so how do you think I can do research fellowship? Because it's a postdoctoral research fellowship. You should have some experience in doing different experiments like Western blots or PCR or different kind of in situ hybridization or immunohistochemistry or things like that before you get into a research opportunity, right? But I didn't know any of that. And she was like, if you're interested and if you want to learn, I'm all open to you joining. So that is how I ended up in this research fellowship. And I can say it doesn't happen very often. So God just opened that door to me so that I can get into this position, which created a lot of opportunities for me. So now I moved from a volunteer position to an employee of Indiana University School of Dentistry with the only background I had was BDS. But that helped me to meet more people in the school. That helped me to have sit in classes where I could audit. Now I cannot get a credit because I'm not a dental student of IU School of Dentistry, but I could audit classes, which means I could sit and listen to faculty talking, which was a big thing for me because I always love to learn. So sitting in various classes, getting their experience, listening to that just was wonderful. And also in the meantime, I could do these research projects. I could present at various conferences. And I also published a paper in that 2008 to 2010 period, which created a lot of opportunities when I applied for my PG program for oral and maxillofacial pathology residency at Ohio State University College of Dentistry. And one of the reasons I chose this program was specifically because of my residency mentor, Dr. Carl Allen. So Dr. Carl Allen is actually a student of Dr. William G. Schaefer. And Dr. Schaefer was in IU School of Dentistry probably from 1960s till 1990s. And Dr. Allen graduated from Indiana IU School of Dentistry in 1980. So after graduating from IU School of Dentistry as an oral pathologist, he went back to his own state, which is Ohio, and he is the one who started this residency program at Ohio State. And just like Dr. Schaefer's book, Dr. Allen's book is world famous. In fact, in the United States, we follow Dr. Allen's book. We do not follow Dr. Schaefer's because there are no new updates or new revisions to that book, right? So currently all the dental schools in the United States follow Dr. Allen's book. So I was so lucky, I would say, and blessed to learn from such a world-renowned oral pathologist, and the experience I got was amazing because his wealth of knowledge, like he's been practicing since 1980, and I joined for oral pathology program in 2013. So the experience he had, and because he's so famous, he will get like clinical consultations every single day from different oral pathologists all across the world. So whenever he get and that would be challenging case, otherwise the other oral pathologists would have solved the problem, right? So whenever he get a case like that, he would call all the residents and he would discuss that. So it was just a wealth of knowledge which we could just gain from him. So that was my reason why I chose Ohio State University College of Dentistry, and my research mentors at the program where Dr. John Kalmar and Dr. Christine McNamara. I had a wonderful opportunity to work with them as well in translational biomarkers, which I'm still working on actually, which my hope is that it will help you to differentiate like low grade and high grade pre-neoplastic lesions like epithelial dysplasia. We oral pathologists know it is very subjective, like when we diagnose a mild dysplasia, moderate dysplasia, and severe maybe not that much, but between mild and moderate, it is it's kind of very subjective sometimes. So, and at the same time, we also know that even though most of the oral cancers are developing from those dysplastic lesions, the precancerous lesions, sometimes before even you could predict, like patient is already having squamous cell carcinoma, we get to see like in the United States, oral pathologists also do clinical practice. So we get to see a lot of patients where it was looking so innocuous, or it was such a faint little white plaque, and suddenly it became squamous cell carcinoma even after follow-up. So that is where like that low grade and high grade predysplastic lesions comes into a role, where we should be knowing like which is a low grade lesion and which is a high grade lesion, and if we know that, we can give like personalized treatment to that specific patient. So that is my hope with my research project, where I can identify these two biomarkers which I'm currently working now, and take that even to the salivary diagnostics approach, where you don't even have to do a biopsy, but using saliva, you can differentiate those low grade and high grade lesions. But my 3 years at Ohio State, I can say it was beautiful. I had a lot of opportunities. I did a research thesis too, where I got the Waldron Award from American Academy of Oral Pathology, and I published that paper. It is actually in the Quadro, and I was also fortunate to choose my work as the front cover of the Oral Pathology Journal, which I still regard that as a big accomplishment, because many of you know that Quadro has very rigorous, the editing and reviewing process is very rigorous when it comes to Quadro, and so I was kind of very happy when they chose my work to be published in the front cover. And so that was my journey at Ohio State, and moving from there I came back to Indianapolis, but because my husband is still at Indianapolis working at the Indiana University School of Medicine. So I joined Indiana University School of Dentistry, initially as a part-time faculty because there wasn't a full-time position opening at that time, and I came back to Indiana because my husband is still here. But from the part-time, later I became full-time. So currently I'm a clinical assistant professor at Indiana University School of Dentistry. And here at IU, I do multiple roles every day. Like I teach a lot of courses, didactic courses in all different years of DDS students. Then I also teach postgraduate residents. So at IU, we do not have an oral pathology program, but all other residency programs such as oral surgery, then periodontics, prosthodontics, endodontics, like all the different programs, they need to pediatric dentistry. They all need to have these specific courses in oral pathology, because whether you are an orthodontist or whether you are a periodontist, you will get to see oral pathology lesions. So you need to know how to diagnose and identify or refer properly so that patient can be treated properly. So all these residents get specific oral pathology courses. So I teach postgraduate residents, and then I do surgical biopsy sign-out as part of the IUSD oral pathology group. Then a lot of my career time is also devoted to volunteering services, where I do head and neck cancer screening in volunteer student outreach clinics, and also the Cancer Support Community, which is an organization in Indiana who does this annual oral cancer screening, then different colon screening for colon cancer like colonoscopy, then mammogram for breast cancer. So I am also a part of that Cancer Support Community Indiana, where I do head and neck cancer screening. Then, like I mentioned, as I am passionate about oral pathology, mentoring is another aspect of my career, which I completely love. So I partake in multiple different mentoring programs. One is ADIA, Academic Career Fellowship Mentoring Program. This is where, so majority of our dental students in a class at IU School of Dentistry, we have like a class of 120 students graduating every year. In that 120, maybe one or two will decide to continue their career in academics in dental school as faculty. Otherwise, majority go into private practice. So we at ADIA are like in this mission where we have to like kind of educate or kind of mentor dental students when they are there, to give them more exposure to how like academics is, or what is the life of a dental faculty, how gratifying or satisfying that job is. That is the main aim for this ADIA Academic Career Fellowship. So every year I take a dental student who is interested in continuing their career as in academics or being a faculty. Then I am also part of the IUSD Research Fellowship mentoring, where I have my oral cancer research project going on, and I take dental students or dental residents who are interested in pursuing this research. Then recently I also joined as Indiana University's undergraduate research program mentor. So at Indiana University, we have different schools like School of Dentistry, School of Medicine, then School of like the undergraduate college. Like in India, we call it BSc or MSc. So Indiana University also has that bachelor's or master's program. And here, in fact, before you go to dental school or medical school, you have to complete 4 years of bachelor's degree, 12th grade, right? Or dental school. So that BSc, like which they are doing, I also am part of a program, research program mentor there. Then at my dental school, I'm also a faculty advisor for the American Association for Women Dentists. Then with my publications and all of that scholarly activities, I'm in the editorial board for Indiana Dental Association Journal. Then I also serve as a reviewer for Head and Neck Pathology Journal and the JADA Journal. So that is how I kind of keep myself busy and happy at the same time, doing all these multiple responsibilities. But I can tell you it's been a very rewarding so far, and now I will go into this second part of our talk, which is about various different career options for international dentists in the US. So when we look at different options, there are a few, and I have ranked them in the basis of the one which I felt which is most important, and then I have I have ranked them based on that. So first I will be talking about specialty postdoctoral residency training. This is like the MDS which we do in India. So here, when you complete this postdoctoral residency training, you get an MS degree or MSD degree. There are also certain programs where you do not have to do research, and they will give you a certain certificate, and that certificate is okay too. Like you can say that you are a specialist with that certificate, but the only thing is it has to be a CODA accredited program. So CODA, and I'll be talking about in detail as we move further. So that is number one, which is a specialty postdoctoral residency training, which is kind of MDS in India. And then there is the second pathway is called Advanced Standing or International Dentist Program. This is where Indian dentists can come and repeat the DDS or the DMD, US DDS or DMD program, and then become a general dentist after the graduation. And then there are research opportunities. Some people decide that they don't want to go through the rigorous education here, and it is completely different from what we do in India. It is very application based, it is very clinical based. So some people just will decide, I just want to continue as a dental hygienist or a dental assistant. So that is a fourth option. And some people will entirely change their dental career into a different track where they do a master's in public health, or these days there are a lot of informatics program, especially with the data analysis and AI and all that. So some people will take up career in like informatics or even in public health. So in detail about each of these, first one is specialty postdoctoral residency training. This is what I at least from my point of view, this is the one which is most appealing to me, because after your BDS in India, you are directly getting into a postdoctoral residency training where you are going to be a specialist. Now, there are people who would want to continue, who would want to do all aspects of general dentistry. They don't want to specialize. That is okay too. So for them, the second pathway will be much better. So for the specialty postdoctoral residency training program, many people do not know that we can apply directly into residency program in the United States. When I came in United States in 2006, most of the people were advising me to continue with DDS, like to repeat the DDS, do that advanced standing program. But I had already decided that oral pathology is what I want to do in my career, so it didn't make any sense to me to repeat the DDS again, which I already learned in India, and then do oral pathology program. So that would be like another 3 + 3, 6 years of training. So I didn't want to do that, and I knew very well oral pathology is what I want to do. So if you're sure that you want to do this specific program, like the specific specialty, then I would encourage you to apply for direct specialty postdoctoral residency training. But there is one point to remember. Indian dentists can only apply for dental school-based residency training program. There are many hospital-based specialty training program too in the United States, but they will not accept Indian dentists. They will have to have, for them, the applicants need to have a CODA accredited DDS or DMD. So now CODA is actually Commission on Dental Accreditation. So just like how we have DCI in India, Dental Council of India, CODA is the association or is the agency which accredits all the dental DDS courses, all the postgraduate program courses. Like it's the main deciding body, I should say. So when you look into a specialty program, you need to make sure that it is CODA accredited, because there are some other specialty programs which is not CODA accredited. If you do that, like you are probably just wasting your years, because it will not lead you anywhere in your career. So dental school-based CODA accredited programs are where we can apply directly, like after graduation from India. And both BDS and MDS can apply by doing MD. So if you are in your BDS, like if you just finished your BDS now and you are in the process of deciding what to do, it probably would be a good time to directly apply. Just by doing MDS, it's not going to give you any extra credit as such. But yes, of course, it's an experience you can put in your resume. But if you have done MDS already, it's okay. But if you have not done MDS and you're wanting to come here, or you know you will be here, then I would suggest you to directly apply after BDS, like, because otherwise we are again wasting time in India doing the MDS, right? So that is one option. where you can directly do. And that is the path which I chose because I didn't want to waste more years repeating DDS in the United States. I went directly into the residency training program. Now, all of these specialties do not accept Indian trained dentists. The specialties which accept Indian trained dentists are oral and maxillofacial pathology, radiology, oral medicine, orofacial pain, periodontics, prosthodontics, endodontics, some schools, and orthodontics also some schools. Most of the time, oral and maxillofacial surgery and pediatric dentistry are hospital-based residency programs. So because of that, they do not accept Indian trained dentists. Now, there are exceptions. If you are in the United States, you have a lot of experience, you worked with oral surgeon in the university, they know you, you have a lot of credentials, you have research, you have publications, and you're already maybe like have an oral surgery degree from India or somewhere else, then there could be possibility, but it is a very, very rare chance for without doing a DDS or DMD in the United States to get into oral and maxillofacial surgery and also pediatric dentistry. Those two are because they are mainly hospital-based specialty training programs, and you'll be seeing like complicated patients from day one. So they would want you to, and also they would want you to have that unrestricted license because you would be taking on calls, and both surgery and pediatric dentistry will be taking on calls, emergency calls, trauma calls, and all that. So that is the reason why they would prefer you to have a DDS, DMD from the United States first, and then apply for these programs. Oral surgery and pediatric dentistry. Now, for the application process for the specialty residency training programs, there is a website called ADIA PASS. So PASS mainly just means Postdoctoral Application Support Service, and ADIA PASS is a website where you would actually put in it's a standardized application where you would just put in one application to all the programs you would want to apply, and then rather than applying to each of the dental school you would want, which you are thinking about. So, but before you choose a specific program, make sure that program is actually accredited by CODA, because remember, you are applying directly from India, right? Directly after your BDS. So only CODA accredited programs, like CODA accredited residency programs, in certain states, after you complete, you can be eligible to apply for the clinical dental licensing exam, and then you can get the unrestricted dental license. If your program is not CODA accredited, if your residency program is not CODA accredited, you cannot sit for that clinical dental licensing exam, which other general dentists have to give to get a license. So because we are directly applying from India after BDS, make sure if you are doing the residency program here, that is a CODA accredited program. Now, different dental school websites, when you go, you would also see masters in operative dentistry, dental materials, oral biology, etc., which are much easier to get in, but they are not CODA accredited programs, which means after you complete that program, you cannot sit for a clinical dental licensing exam, and that means you cannot get a dental license. So you are here studying for 3 years, paying all the fees, but if you cannot get a license, then there is no use, right? So make sure it is a CODA accredited residency program. Now, if you are planning to apply for this ADIA PASS, this is the website you would go, and this is the link, and they would give the application like start date and the end date and things like that. And here on the left hand side, when you look at it, you would see program finder. So if you, most of the time, sometimes people will know, like before they come here, they know like they are going to come to this place. Like now in my case, I knew I'm going to come to Indianapolis because my husband was working here. So I was mainly researching about Indiana, like Indiana University Dental School and places around Indiana, so that it will be easier way to reach, because United States is a huge country, just like India. So sometimes you would know where you are going, so you can directly go to that school's website. But if you don't know, and if you are just starting from scratch, you can go to this program finder, and if you click on that program finder, it will open another page like this, and where you can put in, like, now some people would be interested in oral pathology, some people would be interested in oral medicine. Some would be prosthodontics. So you can choose whichever program you want to do here under the program type, and then when you click on it, it will open up all the programs, all the different dental schools which offer that program. Once you do that search, you can also narrow it down to your specification, and then you can go from there. And this Adhere Pass, so when you look at the application process, these are the different steps. First is you have to gather all the contents, and then you also need to request some materials from your dental school, dental transcripts, your dean's letter, those documents, and then you will apply in the website. And they also have a checklist which will help you to guide through it so that you are not missing any important document before you start applying. And I have given that in detail in the next slide. So most of the documents which are required are given here. And number one, actually, we have to get our certificates. So our BDS certificates verified by a US organization. And most of the time there are multiple different agencies, but Educational Credential Evaluators, or ECE, that's the most commonly used credential agency. So you will send your certificates to this ECE, and they will do a comparison of the courses and the numerical, the marks which you obtain in India. Because in India, it is based on marks, right? It is in numbers. But here in the United States, it's based on grades. So you have A, B, C, and D. So this ECE, what they do is they will look at the marks which we obtain in India, and they will convert that into a grade, based on whether it is an A grade or B grade or C grade, like that. And first they will convert all the subjects, your marks, into different grades, and finally they will give you a GPA. That GPA is really important because GPA is grade point average, right? For us, again, it is total percentage, but here they call it GPA. And the GPA above 3.9 is excellent, because that is when 3.9 and above is really good, because maximum GPA is 4. So 3.9 is a great GPA to have, but if you have 3.7, 3.8, that is okay too, if you have other supplemental documents to support that. So number one step would be certificates have to be verified by ECE, and after that we have to take an exam called National Board of Dental Examinations. So in the past we had part 1 and part 2 for NBDE, but now it has been combined and it is an integrated National Board Dental Exam. And this exam now, it is in a very different format compared to part 1 and part 2. In part 1 and part 2, it was mainly all straight MCQ based questions. But now with the integrated national board exam, you would be given a clinical vignette and a clinical history and clinical details, some findings, and then there will be certain questions. So each case is like a patient scenario. So you need to have detailed knowledge, and also you have to apply your knowledge to that clinical history and the findings which has been given to come up with the answers for the questions which are given below. And I can tell you a lot of questions are being asked from oral pathology and oral radiology and pharmacology. So when I took I took part 1 and part 2, not integrated national board dental examinations, because I took it in long time before, and that time integrated national board exam, dental board examination wasn't there, it wasn't started. So my part 2, I felt like I'm just giving an oral pathology exam, because almost all the questions were actually from oral pathology. So that definitely helped me after finishing an oral pathology residency program. But now you have only one exam, and this INBDE has to be given before you apply for residency. Now, some programs do not specifically ask you for INBDE, but that is a way to show that you are equivalent to a DDS student here, right? Because you're directly applying for these residency programs after BDS. So it has to be done even if they don't ask it. It is better to be done and have that show in your documents that you have finished this. And also, now the National Board dental examinations are just pass and fail. So you do not get a score for that. When I took it, it was actually score based. So which is also a good thing. So if you have a good score, they know that, okay, you're a good student. So you can do better in their residency program. Unfortunately, there are no scores now, which will not help you to stand out. But it's only pass or fail. So that was the second part you need to do. The third is your personal state, because we're not used to writing something like this. Here, for any application, like even for college application, you apply for any awards, you apply for any fellowship, you have to write like, why do you do what you're doing? So that is something which is very important. And then your CV. So if you are planning to do a postdoctoral residency program, as much as you can improve your CV, then all that really helps. I can tell you when GPA and my scores in National Board examination, the other important factors which helped me was my research fellowship at Indiana University School of Dentistry, my recommendation letters from the faculty at Indiana University School of Dentistry, and my publication and the presentations which I did while I was doing that research fellowship. That had an immense role in my admission process, because I was already here and that helped me so much. Now, that probably will not be the case for many people. So as much as you can do in India, that is important, like research papers or even clinical report papers. Like now, I'm sure in oral pathology, we get a lot of interesting cases. Just take that case and, try to put that clinical case report in one of the journal, or there is any kind of public secondary training programs. And then we need our dental transcript from, before that, recommendation letters. So recommendation letters, if you can at least get one from the United States, because that has an important, it carries a lot of weight, especially if it comes from somebody within the United States, and if it is going to be from an academic institution, even more better. So there are sometimes people, especially when I was doing a residency program at Ohio State, and because Ohio State is really famous for oral pathology due to Dr. Carl Allen, there used to be interested applicants who will come even from different countries, like Australia, like from England, from visiting visa, like a B1 visiting visa, and they will come and stay with us, they will come and stay in a hotel, and they will be there every day. At the same time, you're making connections with people in the United States. So when you later apply for a program, you can actually transcripts, which is kind of in India, it is, we have each year's mark sheet, right? Here, everything is combined into one to prove our English proficiency, and then GRE is required for certain specialties. Now, that was the important documents you would need for any postdoctoral residency training program. And specifically about oral and maxillofacial pathology, the oral and maxillofacial pathology do not participate in PASS program. So you have to look through different dental school websites to see which are the programs which offer residency training, and you have to directly apply. The oral pathology programs, they want to have better control over their applicants. That is why they do not participate in PASS program. And usually it is very hard to get in, because there is only one candidate per year which is being accepted into the program. So it's a little hard, but it is doable, especially with all these the previous tips which I mentioned. And some of the programs you do not have to pay fees, and some programs will give you stipends too, which is an important thing. And it is a 3-year program usually. Sometimes you can extend additional 2 more years to do a PhD along with that, the residency program. Then once you finish the program, you will take the American Academy of Oral and Maxillofacial Pathology's fellowship exam, and also the American Board of Oral and Maxillofacial Pathology's board exam, and that is when you get your diplomate status. Now, these are certain programs which will do give the residency training. Ohio State, Texas A&M, then there is University of Florida in the New York area, but they do not take international dental graduates. So those dental school based or university based programs are the one which accept international dentists. moving to the next pathway, which is the advanced standing or the international dentist program, and they will join either the second half of the second year, like the dental students D2 year, their second half, or into the D3 year directly. So you are repeating mainly that last 2 years, or in some schools you have to repeat 2.5 years, and there are some schools where even you have to do 3 years, but majority is either 2 or 2.5. And at IU we have to do 2.5. You will get into the second year, second half, like in the January of the second year. That is when you would start the IDP program. And IDP program, again, just like ADIA PASS for the residency program, you would actually apply in ADIA CAPID program, where again it is a centralized application, and then you would say which all schools you want to apply, and so the different schools will receive your application, and then you will go from there. Again, the credentials which are required for CAPID, the IDP program, is exactly same as for the residency program. Number of applicants is like I said, for oral pathology, it is just one applicant. So the chances of getting in is very, very much test where they are trying to assess your skills, because remember, you are not doing the preclinical lab with the regular DDS students, right? You are getting before they are giving you that bigger responsibility to treat patients. And sometimes many international dentists, they have been already in US, and they are kind of waiting to give exams and things like that. So they would have a gap too before they start this program. So that is why they want to assess that acceptance, and then you will join the local students along with either their second half of the second year or into the third year. And after the fourth, you compare between your residency program and the IDP advanced standing program. Make sure you're doing a CODA accredited residency program. And once you finish that program, you're only going to be a general dentist. So it's up to you what you want to do in your career. You want to continue as a general dentist, or you want to do as cheaper, and sometimes they will give you a stipend too. But IDP program is very, very expensive. You are thinking about like almost $100,000 an year fees. So by the time you finish, you're talking about almost $250,000 to $280,000. So that is one another factor. But there is one problem with residency programs. Now, when you do international dentist program, you are getting a DDS DMD. Then you will complete your clinical licensing board exam, the clinical dental exams, which sometimes there are different agencies which will give that exam. The bigger and most important one is CDCA. So once you take that CDCA exam, once you get the DDS DMD, once you finish the integrated national dental board exam, you are going to get an unrestricted dental license in the state you apply. But still do that clinical dental, which is that general dentist clinical dental board exam, where you have to do. So after my oral pathology residency, I had to do a class 2 restoration, then I had to do a crown cutting. So you can sit for that clinical dental board exam, and if you pass that exam, certain states will give you unrestricted dental license. But to that, once if you from a dental school, you can still get a faculty license where you can still see patients and teach students and all that. So that was about our advanced standing program, and going into next 3 programs, which is not usually taken up, but I just want to give a little brief idea about that. So research pathway, number 1 is PhD. So you again apply to Indic, has a lot of funding. You will get a stipend. We are there, and we can also apply history and all that. And upon graduation, I got to do in Indiana University before I applied for Ohio State. And then you would join as trees. But one thing to remember, if you complete a CODA accredited program, PhDs are, you cannot treat patients. You can probably, but you cannot see any patients, or you will not even get a dental, like a faculty license, because you do not have a CODA accredited program, either a DDS, DMD, or a residency. So that is something important to remember. And sometimes, like I said, without a PhD, you can get this postdoctoral, get married to somebody who is working here. And I know a few people who are working as clinical research coordinators. So they help there are a lot of at least a small research project as part of their service. So and most of these physician scientists, they will have clinical trials. You would help them, you can directly do. But again, if you have to get a job like that, you will either need to have a work visa or you should be a permanent. More minutes. This is now a hygienist or a dental assistant. So some people in school, which is my taking, I will not go. The exception to work as a dental hygienist is in the state of Florida, where international dental graduates can directly give the National Dental Hygiene Board exam, and then if you pass that exam, you can work as a dental hygienist without even going to a dental school. So that is one option to do. And then dental assistant, you do not have to need to go to any school. You just need to get a certification, and then you can work under a licensed dentist. Then the fifth route, which some people take, is either Masters in Public Health or Informatics. That is where you would again apply directly to that school's website. There is no centralized program like our PASS or CAPIT. So you need to decide which city you want to go. You can look at their website and decide that. And then later after graduation, some people will go into pharmaceutical or biotech industry. Some people will take this MPH or MS degree as an opportunity to get used to more people here, system here, again to know more faculty around, and at that time they probably would be volunteering in certain clinics or even volunteering in dental school. So you would be making you would be making more connections and also better you're improving your CV, where you can later apply for IDP programs or the International Dentist Program or residency program. So I have an MPH or MS in Health Informatics or Bioinformatics, and then apply to dental school. So these are different options which an Indian trained dentist can pursue in the United States to advance their career. And I can tell you the journey is not easy, but with all these, with faith, with help from different mentors, and with your persistence and hard work, you can definitely reach where you would want to. With that, if you have any questions, I would be happy to answer. Otherwise, thank you so much for this opportunity, and thank you for spending your evening with me.
Ma'am, I have a question. Can I ask you, ma'am?
Yeah, sure.
First of all, I would like to thank you, ma'am, for giving such a wonderful insight. We got a lot of idea today. Ma'am, I just want to know what is the career opportunity for the one who has completed PhD degree in India, oral pathology, and if the person wants to apply as a faculty, what are the requirements, ma'am?
Okay, so the person has already completed an MDS too, along with PhD?
Yes.
So most of the time, unfortunately, if you apply directly to a faculty position in the United States, just with the education from India, it is really hard to get in, because there are already a lot of graduates from here, right, in the United States, who are finishing the residency program and also who have PhD, and so with their own US experience applying, right? So it is actually very difficult to get in if you're applying for a faculty position directly from India. Almost all the faculty whom I know in IU and even at Ohio State, they all have done some training in the United States, which will give you more opportunities, such as sitting for the clinical dental licensing exam and getting license, and also getting, the person has an MDS and PhD in oral pathology, chances of getting into an oral pathology residency program is really high, because they are already an oral pathologist, they have research background. So if you apply, the chances to a residency program, the chance is really high. And once you finish that 3-year degree, then you can apply for faculty positions.
Or else, ma'am, is there any fellowship, research fellowship? Once you apply that, then you can be a faculty.
So research fellowship, definitely you can apply, because you are already a PhD, right? But after completing that research fellowship, again, chances for getting into an oral pathology faculty position is very slim. That is very, very difficult because before you teach an oral pathology program in the United States as a dental school faculty, they would want to see an oral pathology program from the United States. Like you need to have an oral pathology program, but you can continue after your postdoctoral research fellowship, you can continue as a research faculty. You may not get much experience, like you will just do research then. You will not be able to treat patients in clinics and you will not be getting much opportunities to teach as well. But you can definitely, based on your, based on how you take it forward, you can become a research faculty. But one thing to note is that an appointment for a clinical faculty and a research faculty is entirely different in the United States. Clinical faculty, normally they will get a position, and because they are involved in a lot of clinic and teaching, which is very important to sustain in the school, they have a different track. But a research faculty is called tenure in the United States. So when you are a research faculty, different universities have different rules, but most of the time, within 7 to 10 years, you need to get a tenure position. You have to have very big grants from NIH or federal agencies, which are super, super competitive. I know many people who have been given research faculty position, but by their 7 years, they couldn't get big grants, or they couldn't have many publications, or they couldn't have many research activities. So they were denied tenure and they had to leave the university. So when you get into a research faculty track, it is very difficult to get that tenure and very difficult to carry on your research process because grants from NIH or NIDCR and all those federal associations are very, very, very competitive. So,
can you please mute? Yeah, thank you. Okay, ma'am. Sorry for that interruption, ma'am.
No, you're fine. So that was, yes, there could be opportunity, but it is a little difficult track to be successfully settled in the United States as a research faculty. I would tell you from my experience, it's a little more easier if you go to the clinical track where you do a residency program in oral pathology or for any specialty, and then you have much better options actually, because you can apply for unrestricted dental license, you can become a faculty in a dental school, or you can do your private practice, and once you are a faculty, it is up to you whether you want to take a research project. Now I am on clinical track, but I also have a research project. It's not a requirement from the university because my major responsibility is clinical teaching, didactic teaching, and patient service. But since I like research, I am doing a research project. But I am not being counted on how much research I'm doing because I'm not on research track. Does that kind of make sense?
Yes, ma'am, it's clear. But I think with the after PhD, maybe postdoctoral. Because I've heard people say that it's easy to get postdoctoral fellowship, and then
it is easy to get postdoctoral fellowship, but after that it is difficult to get a different position. And postdoctoral fellowship is only
it's very clear, ma'am. So I think a residency program is pretty much required.
I mean, that is difficult to get to because there is only one applicant which they would take every year, but especially with that MDS and then when you do a residency program, there are actually, like I mentioned, most of the residency program are 3 years, but you can also do a PhD as part. So you would spend 5 years and then you have better options. So now you have both clinical training and research training. Instead of putting, like you would say, right, putting all the eggs in one basket, just research track, you are equipped with both clinical training and research training. And like you said, getting a postdoctoral fellowship is definitely easier. Maybe even you can do 2 years of postdoctoral fellowship, then apply for a residency program too. And I've seen a lot of people doing that as well.
Thank you so much, ma'am, for giving such a good insight about the career options.
You're very welcome. It's my pleasure.
Now I request Rakesh sir for your valuable inputs.
Thank you. Thank you, Dr. Neetha, for that power-packed and so much informative session. In fact, I think we are still to come out of that, the valuable inputs which you gave us. I must say, in the first half, you took us through your own journey, your own experience. And I think we literally, each of us, relived your experience. We traveled from, from Kerala to the US, and how really great, part of your presentation is, if you have a passion and if you have a goal, I think you can achieve anything. And you have proved that this particular thing is true. It is nothing what we do, we cannot achieve. And that in the same school as that of the great Dr. Schaefer. So congratulations on your achievement. I think you deserve a big round of applause for that. One thing again which actually impressed me from this part of your presentation was the fact that you said all PG residents from other specialities, including pediatric dentistry, prosthodontics, need to undergo a course in oral pathology. So I think that underlines the fact that oral pathologists do make really good clinicians or dental practitioners.
Yes.
So though we tend to overlook this fact in India, I think in the US we have given due importance to this.
Yes, which is absolutely right. Yes, we are kind of seen as a bridge between actually physicians and dentists, because you know a lot about like pathology, the connection between like oral cavity and rest of the body. So it's been regarded very high. Oral pathologists are regarded very high in the United States, which I'm really blessed, and I'm so glad like my passion and that kind of coincided.
So that's something which really impressed me. And then in the second half, you just gave a lot of valuable information, because in India, usually what I have seen in my past 21 years of academic service here is that students after BDS, they either go for PG, they look forward to doing their masters, or they go for private practice, opening or going into, which is definitely one of the students now are looking to fly abroad, looking for research or other options. The second part of your talk was really informative, and I was of the thought that DDS is the only way out after doing BDS from India. But it's really encouraging to see that you still can do a specialty postdoc training even without doing it DDS. Yes. So that is something really encouraging, which will really motivate more of our graduates to come forward. So once again, I think on behalf of KSOMP, I should literally thank you for spending so much of your time and giving such a valuable talk and information to all our young, aspiring oral pathologists. So thank you, ma'am. Thank you so much.
Thank you so much, Dr. Rakesh, sir. It's a wonderful opportunity Dr. Mahija has given, and like I said, I love mentoring, and I'm here because of my mentors and definitely support from my family and all the blessings. So I would definitely like to pay it forward, like in any way I can to help another person. Yes, absolutely. Thank you so much for this opportunity.
All the very best and best wishes to you.
Thank you.
And I would also like to thank the KSOMP Head Office, President Dr. Sunil, Secretary Dr. Mahija, and all the Executive Committee members for having, organized this session, because it's really informative and will really help those who aspire to go abroad. Thank you.
Neetha ma'am, there are some queries in the chat box. So can I read it for you, ma'am? Shall I?
Yeah, sure.
It's from Joel. Good evening, ma'am. Grateful for the presentation. I aspire to take up MPH in epidemiology from US. Could you give me an idea of how the career profile would gonna be, and will it be helpful for gaining admission in one of the dental school?
That's a brilliant question. So MPH, like I said, many people actually from India, like they do MPH because, dental schools, especially like IDP program, like I said, they are only going to take 15 to 20 applicants a year. And the number of applicants which apply like varies from 300 to 500. So the chances are very and first they would call like 100 applicants for interview. Then you have to do bench test. You have to prove your hand skills, and then you get into the program, right? 15 to 20. So like one of us, there are many like that, right? In India, our education is really good. So most of in fact, the IDP number of IDP students who apply to Indiana University, majority of them are Indian graduates. And then we have definitely graduates from like different parts of the world, like South America, then Middle East, and like other different countries too. But it's definitely a competitive, to get in it is very competitive, and especially when you apply straight from India, right? So getting into that MPH program now, I am not aware much about like after MPH, if you continue as an MPH in epidemiology, I'm not very sure about the career opportunities, but I know many people use MPH as a stepping stone to get into dental school, like either to do a residency program or to do an international like IDP program. So it would definitely be a plus for you when you apply, because you would have had that experience of doing a master's in the United States, and you would meet a lot of people along that way. You can also, like whichever university you're planning to do, if they have a dental school, you can email certain faculty, like when you go through the website, you would see different faculties, right? You can email them and ask if they have any opportunity, like politely if you ask, they would be okay in receiving emails. And I can tell you, I get so many emails like every day, like when I open up, like asking for opportunities. So it is okay if somebody has a research lab, like that dental school faculty, they will even let you to come and volunteer. And I can tell you that is how I started. Like I got a volunteering opportunity in one of the research labs at Indiana University School of Dentistry. And from there, it just built on. Like when you show up, people will see you. They will see how passionate you are and how much you want to do. So then opportunities will follow you. So I would suggest you take up that MPH, and then if you are in a place where there is a dental school, try to meet some dental faculty, get in at least some volunteering experience. Maybe even sometimes dental school will let you do a part-time dental assisting, because dental assistants are in much need in dental schools, and because we have like a lot of clinics going on, right? So to help students and things like that, we need a lot of dental assistants. So I see many dental assistants actually in IU who are dental graduates from India. So they just use that 6 months to get experience, knowing different people, and then get their recommendation letters so that they can apply for the IDP advanced standing program or residency program. So MPH is a great option. Like it will put you ahead, especially if you follow, like do research, if you have publications, if you have presentations, all that.
The next query is from Soumya Reddy. Good evening, ma'am. I just want to do DDS and become general dentist. So to get student visa, we should have admission form. But before writing the exam, we won't get the admission form. So based on what visa we can go to abroad and do DDS? Please clarify the problem, ma'am.
Okay, so in fact, like, I just had this question when I was brainstorming what all questions I would get. I was thinking about this because I didn't come like a traditional route, right? I came here on a dependent visa because I got married to my husband, and that is how I came here, and then I started volunteering, got work visa. But if you are coming directly from India, you would see the first and second requirement is getting that ECE done, and number 2 is getting the Integrated National Dental Board of Examinations, right? So for that, you have to get a visitor's visa, like a B1 visa, and come to United States, because that exam is being offered only in US or Canada. So you can go to Canada too, that is okay. If you have any relatives there, that is okay too. So you can get a visiting visa and come here to take this exam, and then you would go back. But in the meantime, when you're here, if you know somebody, some dental school, or you can also try to email some faculty and see if they would let you like observe them for a week when you are here to get an exam, to give an exam, to give that integrated exam. If you can be in a dental school and visit a faculty and do like maybe a week volunteering or something, maybe they will not allow you to do anything, but at least even observation. Then you can write that in your resume. From this date to this date, you served as an observer at the School of Dentistry, which will be something on your resume too. So you would be, to answer your question, you would come here on visiting visa, like a visitor's visa, B1 visa, take the exam, and then you will need to go back. And then you will apply for all the CAPIT process, and once you get an interview, and then they will call you probably for, if they invite you for a bench test, probably you would again have to come back in visitor's visa. And then once you get the acceptance, then only the universities will process the student visa for you, because you have to have the acceptance letter to obtain that I-94 and like all the student visa requirements. But the exam, volunteering, bench test, all that can be done on visitor's visa.
Next query is from Sudhira. Good evening, ma'am. Firstly, presentation was perfect.
Tara, you're not audible. I know the other participants to just mute so that we can hear what the discussions which are going on.
Naila Ahmad, can you please mute?
Naila Ahmad, you need to mute.
Yeah. Okay. May I know which program is worth taking up for one who have done the MDS oral pathology in India to be a clinical dentist in US? That's the next query now.
It doesn't matter which program you do. Like, to me, I would say Ohio State is number one, because I did my program from there. But unfortunately, Dr. Carl Allen is not there anymore. He retired. But Dr. Kalmar and Dr. McNamara are equally amazing too. They are very experienced, but all the legacy of Ohio State is still there. You wouldn't believe it, the number of, when in our training, one important aspect is there is something called Friday seminar. So this Friday seminar is when 25 challenging cases. This will be like super challenging. 25 challenging cases from all across the world. So different universities participate in this slide sharing. We get from South Africa, we get from Australia, we get from multiple different universities, and like from also different universities across the US. We get from South America, we get from like Central America, like Mexico and Guatemala and different places. So every pathology program, what they do is they will start to collect these challenging cases. These will be extremely challenging, where you would have spent days to kind of sign out as experienced pathologist. So once you have cases like that, they will keep a tab and they will keep a list where you will start collecting all the cases. Once you reach 25, you will cut those slides and send it across different universities which is participating in this program. So at Ohio State on Fridays, so Friday is kind of like we don't work on Saturdays here. It is Monday through Friday, and Friday usually the approach everybody is like, oh, it's Friday, it's kind of going to be weekend, so most of the people take it in a relaxed way, like especially Friday afternoon. But Friday afternoon in oral pathology program is the most grueling part, where we have this challenge seminar where you would be given this box of 25 cases in the beginning of the week. So you will we will get the cases, just H&E slides, okay? There is no special stains, there is no immunohistochemistry, and you have like a few days to work these cases up, and Friday afternoon, all the faculty and all the residents will meet, and we have to present, like we have to come up with our diagnosis. And that is the most terrible experience, I would say, especially as a first year resident. Maybe in the first month, you don't know what you're seeing. You're only seeing pink and blue, nothing else. You cannot differentiate anything. So, but you have